So on behalf of the Australasian Leukemia and Lymphoma Group, it gives me great pleasure to present the first results of CAST, which is a randomised trial testing post-transplant cyclophosphamide for patients who are receiving a matched sibling donor. I don't have any conflicts to disclose. So blood stem cell transplantation from a matched related donor offers really the best hope of cure for patients with aggressive blood cancers. However, graft-versus-host disease, where the donor's immune T cells attack the patient's healthy skins and organs, really threatens that hope. So the current method of preventing graft-versus-host disease uses a combination of two drugs, cyclosporine and methotrexate, or tacrolimus and mycophenolate, to suppress that donor immune cells. And this is only partially effective, with about 1 in 4 patients either succumbing to or living with long-term illness as a result of graft-versus-host disease. And really we need better, more effective methods to reduce the risk of graft-versus-host disease without increasing risk of infection and increasing the risk of relapse. So this was a cooperative group study led by the ALLG, and so it was a study performed across 10 Australian sites and 2 New Zealand sites. And it tested the hypothesis of replacing methotrexate with high-dose post-transplant cyclophosphamide to see whether it could prevent GvHD. So patients were eligible for the trial if they were adults and were having a blood stem cell transplant from a matched related donor for either acute leukemia in remission or myelodysplasia. And overall, there were 134 patients that were randomly allocated to either cyclosporine methotrexate or cyclosporine and post-transplant cyclophosphamide, and they were followed for a median of 3 years. So 3 years after transplant, the new drug combination of cyclosporine and cyclophosphamide tripled the number of patients who were alive without disease and had not suffered significant GvHD. So at 3 years, this increased from 14% to 49%. Importantly, this new drug combination didn't increase any toxicities. There was no increased risk of infections, and there was no recurrence, increased risk of recurrence of the blood cancer. So in conclusion, I think we've shown that cyclosporine and cyclophosphamide offers the new standard of care for prevention of graft-versus-host disease from patients that are receiving a matched related donor transplant. And I think also it is important to demonstrate the power of a cooperative group, which really does address patient-specific care and outcomes.